morning, everyone. And today in this episode of the Legends of Neurology, it is indeed a privilege and an honor today for me to introduce to you all a figure in neurology whom you all know, of course, who needs no introduction. He's been a teacher, a mentor to so many of us, who's shaped the careers of so many of us across India, across the world. He's made enormous contributions to the world of neurology. And I refer to none other than the ever smiling, affable, but also at the same time, highly instructive and incisive teacher, a hard taskmaster, Professor Sudesh Prabhakar. Welcome, sir, and thank you for sparing your time today for this.
Thank you. Thank you.
So good morning, sir. And I myself have been your student, and I distinctly remember the first day I met you after the counseling, which was delayed for some reasons, and then thereafter you were extremely at that time concerned, and you told me how to get things done fast and just join as soon as possible. And then after the ward rounds, where all our foundations of neurological learnings were laid, was a very important and a distinctive feature of your teaching, and was definitely the amazing clinical bedside and the clinical signs you used to demonstrate. But amazed that another distinctive feature was we would get to listen a lot of traditional learning along with neurological learning in terms of proverbs in Punjabi, which truly even I didn't understand, although being from Punjab. And those are effective way of driving a point home. So let's start from here, sir. How was this proverbial method developed? Is there some story behind this? I'm sure a lot of your fans, your ardent students would be curious to know about this.
Dheeraj, thank you very much. And this is a very interesting story, of course. I did not go to school till about 8 years of age, because my father, he felt that one should teach his child the native language. So he decided to teach me Punjabi. So I learned Punjabi when I started learning till I went to school at the age of 8 or 9 years. And I prepared myself for graduation in Punjabi, which was Buddhimani, Gyani, Vidwani. This was the name. And the only bad point was that when I wanted to appear in the exam, they said 8-year-old child cannot appear in Punjab University graduation examination. So that is where my Punjabi learning ended. But it all started with Punjabi and nothing but Punjabi.
Wow. So that proves a point that mother tongue plays a big role in developing our neurological connections in later life, and how important it is to know your mother tongue. And so, importantly, we realized that while we were training in PGI had a very distinctive flavor of training, and we all of us, we swear by the training pattern and the training which is given to us. So tell us, sir, you also trained here and you did your DM. I'll ask other questions, but let's come to this moot point. So this training pattern, was it still as rigorous as when you were training, or did it evolve? And later, how did this come to develop?
Dheeraj, I was the first civilian DM student of PGI in 1976.
70. Okay, yes.
At that time, there were two people from Army, Colonel Rana and Brigadier Kumar, and I was the first civilian one. There was no teaching activity at that time. We were doing what we thought was good. Dr. Chopra single-handed used to tell us what to read and what not to read. There was no internet, and there was only Index Medicus. And if you are aware, Index Medicus used to be of about 20 or 30 or 40 books. And if you had to look for something, you would look into that Index Medicus and then find a reference which you are interested in. So at that time, after me, Radha and Murthy, Dr. Radha Kishan, who retired as a director of Sri Chitra, and Dr. J.M.K. Murthy. We all three, we planned the whole teaching program. We sat one day and we thought this is how the teaching program of DM Neurology should be. So we were the mentors of our own teaching program, which was bedsides, seminars, ward rounds, teaching rounds, neuropathology, neuroradiology. We planned, all three of us planned, and the topics, the subjects, we reviewed the index medicus, and because we did not know what is happening in other part of the world or in India, because the media was not that strong at that moment. So this is our brainwave, and I'm very happy to note that till I retired in 2014, this system which we had planned went on very well, with of course certain changes, but it is doing well, and many institutes in the country, they have followed with these sessions, including the Saturday session of combined neurology neurosurgery round.
Truly, sir, I would totally agree. So basically, we can say the giants of neurology, and like talking of Dr. Radhakrishnan, yourself, Dr. J.M.K. Murthy, they created the program which created more giants and, big stalwarts in neurology. And they've all emerged from this very stringent program. And like true to what you said, this is what establishes the foundation and established for so many of us over here. So another here, so you, sir, you spent at least what I came to know, 43 years of academic life in PGI. That's a huge lifespan and an academic life. And as a head department of neurology, I believe it was 21 years, from 1993 to 2014. And your contributions were immense. I would not like to elaborate. I'll take another hour. So what is more interesting, we want to know is interesting anecdotes in that lifespan in neurology. For example, when I came in, of course, the index medicus was there even at our times. And in late 90s, we were also initially, but by the time I finished, the internet started. So the coffee club, this was one of the most interesting things. When I came in, I found in between the rounds that we were thrashed, and we would sit at the coffee club and everything would dissolve there. So tell us something, sir, about the coffee club culture of neurology.
That's very interesting, because this coffee club somehow when our teachers, they were in UK, so they had this pattern of coffee club, but it was not existent in PGI. So when I started there, Dr. Chopra and Dr. Gulati, they wanted some sort of that thing, and we started with the subscription from all the faculty members and the students. Everybody had to pay 2 rupees to get 1 cup of coffee. And it was very strict. Everyone has to pay, even if you take a coffee for a day. So what we would do, we would see to it that if in the vacation period, when the faculty would come, so at least they would take 1 cup of coffee, because that means they have to pay the
Exactly
for the whole month. So it started from that time, and it's very interesting that it has continued with all ups and downs even till now, I understand. Because coffee club doesn't mean taking coffee. Coffee club means knowing the person. The faculty knows the students knows the faculty. We come to know about their problems, both academic and non-academic. And I think it is a very nice way to learn also. Because, see, you also remember that if somebody makes a mistake, whether it is faculty or a student, you have to give samosas to everybody. So this culture started right from 1976 onwards. And that
amazing, sir.
You remain very active, number one. Number two, you don't make mistakes. Number three, if you make mistake and you have to give samosas to everybody, you will remember throughout your life that, well, that mistake is not to be made. And of course, the personal problems of the residents, they were also solved at that time.
I agree, sir. It was an amazing initially it didn't strike me, or I'm sure people who came in, that what is the in-depth real significance. But one was, we saw neurologists and neurosurgeons sitting across the table, and sharing a laugh, which would not really be seen. I've heard this never happens across the country, and this was the only institute where this was prevalent, and that was a big surprise. And how the coffee club honed all these patterns. And true to what you said, big learning happened. In fact, it was a lesson in humility too, sir. We would learn how to make tea. As soon as we came in, the first lesson before neurology was how to make good tea, and the junior most would make tea for everyone. And and the same inculcated to the MD residents who came in. And I think that's what, although it was coffee, but it taught us a lot of neurology. I would totally agree. So moving on further, sir, while you had been here as a student in DM, and you graduated I think you did your graduation in Rohtak, and thereafter your MD in PGI, and thereafter. So what I'm sure everybody would like to know, what shaped your thinking or inclination towards neurology? What came to your mind that you have to be into neurosciences?
See, it is not that I wanted to do neurology right from the very beginning. When I joined PGI, that was the time when you had to do house job first, and then you had to repeat the house job after 6 months. So during those days, we used to do one medicine house job, one surgery house job, and then you appeared in your PG entrance. So there were 3 exams, one for first house job, next for second house job, and third for the PG entrance. Now, it was a very difficult exam, as it is now. So I did orthopedic house job, then I did medicine house job, and then I entered MD medicine. During MD medicine, I was given a thesis under Dr. J.S. Chopra. And that thesis, the topic of the thesis was on young stroke. We had a very good stroke neurologist, Dastoor. So once he came to attend one of the conferences, and that was a time when there used to be visiting professors. So he was the visiting professor to the Department of Neurology. And when he came, he suggested that you do certain studies on the stroke in young, which is a new upcoming topic. So that is how I joined neurology fraternity in PGI. And it is a very interesting story. When I joined, when I took thesis under Dr. J.S. Chopra, I was told by other residents, congratulations, because there are 2 earlier people who joined with Dr. Chopra, and they never completed their thesis, and they have not been able to appear in the exam because he was a very hard taskmaster. And as we know that earlier there used to be no computers, so we would be typing our thesis ourselves. So I remember I first typed myself, and then I got it from outside. 10 times I got my thesis typed, but luckily this thesis went on, and my interest in stroke and young developed, and that is how I could continue after MD medicine in neurology.
Excellent. And true, I think it's a lesson for all of us, where we now cut and paste. We don't have to repeat, type, and do such a major task to write a thesis. Sir, so you have been also a student of the legendary Professor J.S. Chopra, and we all know that he was a tough man to work with. And he's, of course, left a vast legacy behind him. He would be all very eager to know about the time you trained under him, also became a faculty. Anything you would tell us about your training period, and also the people who shaped your career? Who would you consider important people in your life?
See, Dr. Chopra was a very hard taskmaster, very hard taskmaster. He would abuse you in chaste Punjabi, right in front of everybody. But he had very good points also. He was very good at heart. He would shout at you in the rounds, and at the coffee club, the tea room, he would be just laughing. He would forget what he has told there. And that is how you develop confidence. As a neurologist, Rat Chopra, I always used to say, he had some sixth sense. When he was discussing a case and something would happen, and he would say, okay, this is the diagnosis. We would ask him, why do you think so? He says, Pata nahi, bas diagnosis ko wahi milega. And that is, I call it sixth sense. And after all the investigations, we will be surprised that that is the diagnosis. So that is how the things went on. Then there are so many good neurologists who were there when I was doing, and Radha and Murthy, we were doing our DM. I mean, all of them have gone to states now. Nobody is here in India. But we had a very good teaching staff. And the Tuesday round would start at sharp 9 o'clock and would finish at 4 o'clock. It was not that it will finish at 1 o'clock. No. And all the 3 or 4 consultants would be there till 4 o'clock. And they will be grilling everybody. So that is the basic thing which one has to understand. That the teaching at that time was in such a way that you have to be so much involved in teaching and learning, which I think at present we don't have that much time. When I left the PGI, I don't think I had time to be in the rounds till 4 o'clock. No. But this is
That's
how
what I believe. The investigative part of neurology, which has come in, has left little time for us to put into discussions, which of course was the traditional way of neurological teaching, but laid the foundations. And I believe the old classical teaching did leave lasting impact on all of our neurons. And sir, you also had, while I remember, you would have certain your own theories which you would elaborate upon us. One, especially the sauce bottle theory, I remember you would tell us. So how did you develop those? And
See,
so many, so and so forth.
these theories, so-called sauce bottle theory and theory, they're very interesting because they have been developed by us only. Then nobody has invented them. It is like that if you have to extract somebody, knowledge from somebody, then you have to be like getting sauce out of the bottle. So with great difficulty, if the knowledge comes out, if the answer comes out, it was like a sauce bottle theory. Or if it's tube light theory, that he will tell you 1, 2, 3, and then the tube light would brighten up. So it was made right on the Saturday meetings, this sauce bottle theory, tube light theory. And then, of course, there was a Caesarean section. Like you have to extract everything out. He will not come out. The candidate will not come out of whatever it is.
True, exactly. That was quite an interesting thing. So, sir, all during this time, there are a myriad of achievements that you had. Just to name a few, of course, you have been the founding fellow of the Indian Academy of Neurology, and we are all, the entire neurology community is a part of it. Now we don't know the hardships which everyone, the forefathers went through. So how did that come to pass? How did the Indian Academy, the inception of Indian Academy?
I think all the senior neurologists know that the Indian Academy of Neurology, when it was started, it was because the Neurology Society of India, there were more neurosurgeons than neurologists. So when the time came to become president or secretary, the neurologists would never become president or secretary because the number of neurosurgeons was more. So if then there was the World Congress of Neurology and then the World Congress of Neurosurgery. So the president of neurology and neurosurgery, they were alternating. That 1 year it is neurologist, 1 year it's neurosurgeon. So something happened that when there was the World Congress of Neurosurgery, it was a turn of neurologist to become the president. So everything started at that time. And then I think whatever happens, happens for the good. So Dr.
Exactly.
Chopra took the lead, and I was the trainer. Dr. Chopra was first the president, and then he was the secretary. And then the Neurology Society of India was divided. Not divided. I am still member of Neurology Society of India. So Indian Academy of Neurology was born, and it is now grown like a very adult person now.
Definitely.
We are proud
And I
of
think
the Indian Academy of Neurology.
it's grown vast and it has really spread its wings. And in fact, this program is also by the Indian Academy of Neurology. That shows uh, how much developed it has become now. And I think we need to thank uh, people like you and our senior teachers who thought of it. And it's a major platform for the neurologists currently, and it's one of the very good academies in the world, I would say, rated as a uh, highly instructive academy. And sir, so another big achievement which I would like to highlight is you were the editor, chief editor of Neurology India, and I still remember the office within this department and piles and piles of Neurology India lying here. And that point of time, I wonder how you divided your time between the very extremely busy schedule in neurology and the editorship of Neurology India. Mostly, what I heard here is editors take a full-time job internationally when they go into a major journal. So, and of course, the achievements about Neurology India. Let's hear a little bit about Neurology India, sir.
See, Neurology India, before I took over, Dr. Chopra was the editor. And before, he took some pains, but the journal could not be indexed. So when I took over, my first main aim was that Neurology India needs to be indexed in the Index Medicus. Only then its value and significance will increase. You will be surprised, Dheeraj, that there were no big houses like present now who were published the journals. The journal was printed, published, and posted from the Department of Neurology.
Oh.
There were no money available. We had to get the advertisement from the, now even the Indian Academy of Neurology gives money to the, because I saw to it that when I left my 6 years of leadership, that journal should get some money from the academy. Earlier, I was arranging by pulling strings with the drug houses, pharma houses to get the money. So you had to arrange the finances, you had to arrange the article, and the editorial board would do nothing. I know every available time with me, with the help of my faculty colleagues, we were using it to read the articles, then correct the articles, change the English language, and then publish them. The main idea why the indexing came was the regularity. In the beginning, the Neurology India was not regular, and the articles were of very poor quality. So the quality improved, the regularity improved, and in 3 years, we could get the journal indexed. I think that was a very good achievement.
That's
to
true,
get
sir.
the journal
I
index.
think we all need to thank you, sir, for this major achievement, because the indexing is a major turn in the, I think, life of a journal and turns it around completely. And like you said, and even whatever in feedback I've got, whatever task was handed over to you did see the light of the day. That's how I know. And you would make sure that this is executed. So during your time here, you were a very able administrator for the department also, and your everyone, the staff, of course, beyond the students, your staff fondly remembers you, and they simply would tell me that they could walk in with their difficulties. They had no hesitation in going to your office, and you'll always they were not afraid of getting into your office. And you would hardly ever get angry. And rarely have I seen you getting angry or raising your voice to people. So how did you develop this art of administration? Any philosophy you followed for your administrative skills?
Dheeraj, this art of managing things is your inborn. You don't learn. You would have seen so many head of the departments. Everyone has got his or her own character. It's not that they are taught to administer like that. I always felt that the chairperson of the department is not a touch me not thing. And everybody should be welcome inside. And I had the habit of barging into the rooms of my faculty members to say hello or to ask things rather than calling them. I think it helps because it helps in making one-to-one contact. Otherwise, I could have got the things on phone also. But definitely, I always thought that going to the person's room and sitting there for 5 minutes and getting the information is more personal than getting it on phone. So, and secondly, as a head of the department or as a senior colleague, I had the advantage of being the head of the department, being the professor of the neurology for a long time, and being the teacher earlier of my faculty members who were my students. So I had this good luck, and I knew good and bad points of everybody. So the basic strength of a department is that the good points should be highlighted. So what I thought and what I did was to give a person responsibility in that field in which he is excellent. So I knew he can have a very good song and the guitar. I would see to it that Dr. Dheeraj must sing a song in our meetings.
True. I think that's big learning for all of us and the people who are in their formative years, because everyone gets onto some time or the other get to a leadership position, and I think such properties and such philosophies are very important to have an effective leadership. So coming down a little bit to your other side, non-neurological side. So your college days, I came to know Dr. Very good friend, Dr. Kamlesh Mansal, and he's in Bangalore these days. So he tells us that you of course, the simple thing that you were always very happy, cheerful, as we've all noticed you, and you were very simple in your ways. Always, you had no major, desires, and you always were very simple living. One thing he tells us that in the morning you would wake them up with a prayer and a bell. And you would use that, it was very regularly you were praying in the morning, you would pray and the bell would wake them up. So are you still a very religious person, sir?
I don't know how you got this information. The things do change with time. I am still a God-fearing person, but I don't use the bell now. But this being religious helped me a lot because when we went to the medical college, we were given a dormitory in which Kamlesh was my dormitory partner. So after the first 4 months, I realized that I sleep at 10 and get up at 4 o'clock, and everybody else sleeps at 12 o'clock or 1 o'clock, and they get up at 8 o'clock. So there was a great difficulty in managing, and they would be very upset with my whatever religious chants I would do. So then I came to know that there's one room which is lying vacant for many months. So I asked the person who was giving room that why this room is vacant? Why can't you give it to me? So he said, "No, tum chale jao, isko nahi dena." And then I came to know that that room had very great history. There were 3 students who went to that room, and all of them went to psychiatry department. Okay. They became, one became schizophrenic, one became manic, and the other person I did not what. So, and the 2 of them left the course, and third was still managing under psychiatry. So they said that, no, please don't go to that room. So I told them, I want to be in a single room. So I was one of the very few persons who got single room on the first year of my this thing. I said, okay, I don't bother about any bad souls. So give me the room. And they were saying, "ये भी पागल हो गया, ये भी वापस जाएगा, secretary department जाएगा." But I was lucky. I don't know what was there in that room, but I remained sane and I remained in a single room right in the first year of my MBBS.
Wow. So that really reinforces the belief of believers, I would say. They really, I would share some pics at this minute, sir, at this moment, and let's see. So this, so this picture, sir, I got from your archives. This is, I believe, Dr. Kamlesh, who's
Yes.
your batchmate, and this is your photo from the
This is photos from the
MBBS.
school when
Right, sir.
when I was second in the university for my +2 exam.
Oh, excellent.
That is the
That's good.
12th exam. It was not only
Okay.
12th, it was higher secondary at the time. So this is the
Okay, sir.
principal of the school. So he's honoring me on the day of the result that I was second in the university. And that time it was Haryana, Punjab and Himachal together.
Oh, great.
So it was that Punjab University.
Wow.
And this is the second photo, which is a medical college. I was the class representative of the class. So
that's why you're sitting. Everyone is standing.
This way I was sitting, all of them are standing. I was the CR, class representative. So
Right, sir.
this is very, very interesting photos you have picked up. Thank you.
And,
Thank you for showing.
And sir, of course, Madam Dr. Indu Prabhakar. We've always seen you two together in such a beautiful couple, wonderful. So how did you meet? Everyone wants to know. How did you meet Dr. Indu? What's any story behind
it was an arranged marriage. We had not met each other. So I got married in 75. She was in PGI doing research associateship, and I was doing my house job. MD. I was finishing my MD. So it was an arranged marriage, but the marriage has been very successful. We have been
absolutely.
We have been lucky. I have been lucky, not we have been lucky. She was totally interested in academics. She never wanted to do a private job, but she had to do start her own practice because at that time there were no faculty posts in PGI.
Right.
So that is where they started. We had 2 sons, and I'm very happy that both the
so both of them are in consultants in
both
PGI.
the sons are consultants in PGI. One is professor in orthopedics, other is in interventional neuroradiology. So God has been great, and I am grateful to the God for that. And these are my grandchildren.
Right, yes, I remember you telling me that, sir. Of course, let me tell you for everyone's knowledge, sir is an amazing, quintessential family man, family person. And like you said, I have actually my only photo of Sharad. Anuj's photo I couldn't get, but yes, I have a photograph of both her daughter-in-laws and your grandchildren. And I believe I was told that your 4 generations live together. that's a great, I would say.
Yes, it is a very, very interesting situation. My mother and father both are 98 years. Amazing. So they are with us. So then me and my wife, then my both sons and their wives, and then 2 grandchildren each. So we are 4 generations. And recently we had COVID. So it started from the youngest one and it went on to involve the eldest one.
Right, exactly, sir. And some early years.
Yes, this is in PGI. This is my convocation of MD medicine.
Right. Okay. Right.
And this photograph is of the batch of the MD medicine at the time.
Right, sir. This is MD. It's outside the Carom block, I believe.
Yes, I am right in the middle in that group photograph. This is in front of the Carom block. This is the all the 3 years of MD medicine at the time.
Yes.
Because my seniors and beyond seniors on that. This is our
so a lot of Yes, you did a lot of conferences here. So that's, I think, your entire staff who's along with you and your faculty colleagues. Kiran remembers you so fondly that you would scold her also so many times. Kiran has been, for everyone's information, has been with our department. She was the computer expert in our department who would create so many uh, presentations for everyone. And she gives us, she fondly remembers you, sir. And of course, the
See,
rest. And
here
these,
is the conference business. The conference has become business now.
yeah, exactly.
Earlier, it
True.
was a personal thing. Like if I have to arrange a conference, I will take all my faculty members along with me, along with my residents, and it will be like a marriage in the house. Everybody is involved in one way or the other. It is not
Yes.
that you give it to a event manager and then you sit and relax. It was not there like that time. And I have been
It's
very
become
lucky.
competitive. You're right.
I have been very lucky. All my faculty members, they helped me in all the meetings, all the conferences. They helped me just like in the academic programs, they helped me in the non-academic programs as well.
And true, I remember being part of the NSI, which happened in 2003, I think, two. And it really becomes, it's like a family working for a family function together. And this, of course, is one of the later meetings, our brain bee, where Professor Prabhakar and yourself. This is, I think, another
yes, this
meeting
is
of
during the Indian Academy of this is the NSI meeting. NSA meeting.
This is likely
because the
NSI,
neurosurgeons are right in the
yes.
center.
Yes. True, true.
Yes.
Sir is also there. You're also there on the third row.
Yeah.
And this, sir, this is a very surprising. Now you would see this is a picture before I joined DM, but I'm still here on the behind you.
Yes, 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 yes.
This is actually Dr. Gagandeep. I had finished my MD and he brought me along as I was SR under him in DMC. And this meeting, I think, is the Delhi meeting of the ODNS, first with Dr. Chopra
Yes,
organized.
yes, yes, yes.
And that's why I happened to get a sneak peek of neurology before I joined this place. This was, I think, at least a year before I joined, 96 or 97.
Very nice. Yeah,
This is
my
the
old things. This meeting is the lower photographs is at the Hotel Taj. This is during World Conference on Neurology.
The big meeting, the World Congress of Neurology.
World Conference of WCN meeting. So this is at that time.
True, true. And this is the IN, I guess.
That is the IN.
This I've shown. So, sir, now you still stay connected with academics. I'm sure once you're once in academics, always in academics. So, how do you spend your time beyond neurology and patients? What are your other pastimes currently?
See,
you have a busy practice, I'm sure, even in the private sector.
See, when you are in PGI as a senior faculty, you work from 8 to 6, and then you are free afterwards. Of course, you can get a consultation call and all that. But in practice, I am busy from 8 a.m. to 8 p.m. So I am become busier, but it's a good thing because whatever you have learned in PGI, you need to, and whatever you have been teaching to your students, you have to practice.
Absolutely.
Because it is a question of 15 to 20 minutes or 25 minutes, and you have to make the diagnosis, and you don't have to don't have time to go home and read, because the investigation is available. If you want MRI, if you want conduction studies, if you want EEG, everything will be done in an hour or so, and then you have to give your diagnosis. And people come for second opinion, and they are really great because they will not show you previous papers. And only once you have made a diagnosis, they will say, we have been shown at PGI, we have been shown at NIMHANS and all this AIMS, and this is what they thought. So that is the part which is different in the practice. And I'm lucky that at my center now, there are DNB students, and I am teaching them. We have got every week 2 sessions. So bedsides are there. So I'm trying to, whatever possible, We are trying to, because one thing I have learned, that if you do not teach,
True.
you become, just your knowledge goes down. It is only interaction with your juniors, with your students, that you remain active, your brain becomes active, and you learn more. Actually, the students are your teachers. And once you stop teaching, once you stop learning from them, you tell them, no, मैं ही ठीक हूँ. जब ये attitude आ जाएगा कि मैं ही ठीक हूँ, then you are gone, because that is the end of your knowledge. And this is what I always thought. It is very right to say, मुझे नहीं पता, I don't know, rather than saying, मैंने तो वो एक केस देखा था 20 साल पहले, तो इसका diagnosis यही है. So that is not the way. Diagnosis anybody can make, but the analysis of the problem and everything, it is a scientific process, and in the scientific process, the interaction with the students is the most important. If you want your brain to remain active, if you want to be knowledgeable, you have to learn from your juniors. You don't have to rebuke them. Okay, no, you are stupid. That's not
true.
done.
These are golden words, sir. And I think it's been a great time we've spent talking to you, sir. A lot of things we've learned, a lot of things passively again learned from your ways and your art of teaching and art of neurology. So anything would you advise? You've seen neurology evolving over a vast span of time. What would you advise for the youngsters? You know, there's a different cultural change even in the trainees right now. You would have noticed that too. From our time, of course, we only notice it. If you would cross, you would definitely be. It would be a blatant
There is
observation.
times have changed. When I was in the training, the upper cafeteria used to be a place where the doctor, dean, the faculty, and the students would take lunch or dinner together. And we will be in the queue. It's not that the doctor would come and he will bypass the queue. He will be standing. Sometimes it happened, I was the first, next was the doctor standing outside. And that is the way we started. It was such a cohesive arrangement. And I think that is why when I answered, I would go to your room or somebody else's room and ask questions, because we felt it is cohesiveness, learned that we were doing breakfast together, we were sitting together, taking our lunch together. And then one in the ward, like Dr. Chitani, he was the most difficult person to work with. To have his bedside, it was so difficult. So that's what we learned. But I would like to say that the neurology teaching is going in a phase now in which more importance is being given to the investigations. Whether it is lack of time, whether it is fear of a court case and all that, but we are leaving the clinical neurology at a different place. It is not right. Clinical neurology always will be at the top. The radiological findings, one radiological finding can be seen in 3-4 different conditions. And unless you make your clinical diagnosis, you cannot make a proper final diagnosis. So I would request all my junior colleagues to analyze the patient, see the patient, and then look at the investigations and keep that thing in mind. You will always be rewarded. Of course, the genetic diagnosis cannot be made without genetic studies. But at least I'd come to a conclusion that is the genetic diagnosis. Then you get it done. So being in touch with the basic concepts of neurological examination and knowing what is the research is very important. And secondly, there can be no good academic neurologist without a molecular biology laboratory. I think
Yes.
PGI again did a very good
Yes.
thing to have a molecular biology.
Yeah, I forgot to mention that sir was also behind the starting. In fact, that's one point I missed. Starting the
Yes.
neurosciences laboratory here. And what was your
Now
vision,
that
sir, at that time?
neuroscience laboratory, you do genetic work, you do cell culture, you do so many things, because it is from clinical to the
Bench to
come to
bedside.
bedside, from the table. It's very important. Now it is no time for publishing papers on clinical work or case
Agreed.
reports of what is happening or case series reports. Now we have to correlate with the molecular biology, and that is where the next generation is going to work.
Exactly. So it was your vision, which many years back when we started the neuroscience lab. In fact, when things were not even so well developed in our country, and we started moving towards it. And so today, sir, thank you for. We are running short of time, so it would have been interesting to carry on this conversation, where we are actually learned. We are left enriched with so much of again, I would say, wisdom, which you always tend to give us. You always given us, not just neurological knowledge, but it was it's been a wonderful talking to you, and I think everyone will agree that this wisdom of not only the way you taught us, the way you teach, your administrative skills, and the traditional wisdom, all packed together, makes one a good neurologist.
Thank you.
Thank you,
Thank you.
sir.
Dheeraj. Thank you very much. And thanks to Academy for giving me chance to be talking to you and to all. Thank you very much. Thank you.
Thank you, sir. Thank you so much.